All right, we're going to do injury of the spine. Our first injury is scoliosis, which is an injury that I have. Scoliosis is the lateral curvature of the spine, usually can be seen in the lower thoracic lumbar area, and there's different ways to get it. Either one is the congenital way, is where during the embryonic stage of life, the vertebrae doesn't malform or doesn't grow as properly, making the curvature of the spine happen. Then, as the child is born, they have the present curvature, or it could be due to neuromuscular, which is the reason why how I have it, to a point where, for the neurological standpoint, I have neurofibromatosis, which causes tumors to occur throughout the body. And for my case, the tumor can be as like a space occupied lesion, caused to where the nerve ending of the spine, the tumor caused to grow there and cause the spine to curve. And also can due to neuromuscular reasons, in which any muscular like cerebral palsy or spina bifida, any like neurological or neuromuscular diseases can cause the curvature. Signs and symptoms can be low back pain, uneven shoulders, rib cages, waist or hips. Body would tend to lean towards one side, depending on what side your curve is on, and as well as numbers of tingling down the legs. There's a host of special tests that can detect scoliosis or that could rule into scoliosis. The main one is the Adams forward bend test. It's where the person would bend their body forward, and based on that, usually the clinician can see the curvature of the spine, or if the person were to come in the exam room, you could see the person leaning towards the lateral side, either left or right. It also depends on what side your curve is on. As well as the Valsalva Milgram quadrant test, the cervical compression distraction test, and Sperling's test, and also could detect scoliosis due to the tumor in the space occupied lesion, and well as the scoliometer, which is a device, a little measuring tool device that when pressed against the spine, it can detect the degree of the curvature, as well as X-ray imaging that can see, as the next slide, how your curve is. For treatments, depending on how severe your scoliosis is, you can go to the non-operative standpoint where it is bracing. Either you get just a lumbar brace that only goes to the lumbar spine, or a full spine brace, which has happened to me when I had to use, or using orthotics where it would get a shoe and put a cut insert inside the sole of the shoe to even out the curve of the spine. Or for a more severe case, which was for me, I had to do a spinal fusion where they insert metal rods into the spine to correct the curvature, which we'll see in the next slide. And as we go into the next slide, these are our actual photos of my spine from years ago, from post-op to now. So as you can see on the left of the side without the rods in, you can see at the lower part of the spine, my spine tends to make a little C shape, to a C shaped curvature, which here indicates a severe scoliosis, because as the spine goes more towards this way, the bigger the C is, the more severe the curvature is. And how the spinal fusion will work is they will put the little rods, as you see in the next picture, all along the whole spine. So the rods are more likely pushing back the C to make it more straight. And for this, surgery can last for an hour to a couple hours. Again, it all depends on how long, how severe your scoliosis is, and to the point where, for my case, I had 4 spinal fusions where I had raw inserts not only down the spine, but down on my spine, but I also had raw inserts on the side of my body that also help with the curvature. Next is flat back, which is a condition in which the lower spine loses the lumbar lordosis curvature, causing the center of gravity to put the body far forward. This can be caused by degenerative disc disease, a result of a spinal surgery. So for scoliosis, a result of scoliosis that if the resistance to reproduce can cause flat back, pain in the lower back, stiffness in the lower back, and pain that radiates in the hips or thighs. Most of the same tests for scoliosis can apply here, which is X-ray imaging, the Adams forward bend test to see how the spine is being curved, the Sharper's test, and which measures the lumbar spine flexibility by quantifying flexion to detect restrictions. And for treatments, it all kind of mirrors the same for scoliosis, where for the non-surgical route, it's bracing, physical therapy, medication, and walking aids. And for more severe cases, of course, spinal fusion and osteotomy. And as here's a picture of flat back where you see in the thoracic spine on the left, it has that lordotic curve, that little C-ish curve, but in flat back, that lordotic curve is gone and now presents a straight spine. Our next injury is brachial plexus neuropraxia. The brachial plexus is a bundle of nerves that stems from the cervical spine and the upper trunk sections of the spinal cord, which is usually C5 to T1. And these nerves create a nerve that connects into the arm. But for neuropraxia, if the person were to have this condition, it's due to either 2 reasons. Either the brachial plexus is being stretched by a tensile force, or is being compressed. As well as there's other ways of brachial plexus, which is the rupture, neuroma, neuritis, and avulsion. But for neuropraxia of itself, signs and symptoms would be numbness or loss of feeling in the hand or arm, inability to control or move the arm, shoulder, wrist, or hand, or a burning, stinging, or severe sudden pain in the shoulder arm, which for burning and stinging, that's what the other name comes from of this disease. For a special test, the one main test that truly can detect this is the brachial plexus traction test, which prior to this, if a person were to have a cervical fracture, we would definitely rule that out. But the test in itself says that with putting one hand on the shoulder and one hand at the head, you will pull, and depending on which side you feel pain, it's either through a traction or compression. So if it's on the same side as I'm pulling, so if I'm pulling on this side, if I feel on this arm, it's due to the traction force or the tensile force. But if I feel on the other side where my head is resting at, it's due to it being compressed. And for treatment wise, you either go the non-surgical route, which is PT, corticosteroid, creams and injections, and medications. But for more severe cases, there's nerve repair, neurolysis, nerve graft, and nerve transfer for surgical reasons. And if we go to the next page, these you can see here it shows 2 different types of brachial plexus injuries. So first, we above have the stretch injury, where it's just that neuropraxia, where you can see that little thin lining is the brachial plexus is being stretched out, causing that tensile force. And for the other is the rupture injury, where you can see the brachial plexus is torn apart. Our final disease is Scheuermann's disease, onychokyphosis, which this injury is where the natural curve of the thoracic spine, which normally has the degree of 20 to 40 degrees, have now risen to a degree of 40 to 45 or even greater. This Most causes of this is still being researched, but most doctors can agree that it's due to the damage of the growth plate and the vertebra causing it to the vertebrae, causing it to grow uneven. And this disease can mimic or can lead into scoliosis. So the main sign and symptom for this is there should be a hunched back, back pain, stiffness in the back, and fatigue and or with standing or sitting. And for special tests, as we with the other three spinal injuries I presented, the forward bend test will be a great test to see how the spine curves, and especially with this disease, since it's a hunchback, one you should normally see without the test, but if you do the out of form bend test, you should see the thoracic spine to hunch back a bit. For treatments, there's either for surgical, which usually happens when the degree of the spine, the thoracic spine, is 75 degrees or higher. But in the same case as in like the other two spinal injuries, spinal fusion is usually the common route to fix. And the other for non-surgical reasons, for the degree that's 75 or less, bracing will help fix. As you can see here, this is more of a severe case where we can see the patients have the bigger the hunchback, meaning that that thoracic spine is being caused by that great degree of curve. And based on this, some cases there are is only not as rare, but most causes that curve can also lead into other spinal injury like scoliosis, which in that case the spinal fusion not only will fix the hunchback but also the curvature of the scoliosis. And that's my works cited page.